Can chatbots and AI be used as a suitable replacement for therapy? Nowadays, a lot of people are getting into using ChatGPT and Gemini to help in areas of their lives. And it makes sense with increased loneliness, as is reported, that people are going to be using AI as a way to ask really personal questions or questions that they may just have out of boredom or loneliness or things that come up in the middle of the night. And they'll turn to these chatbots on the internet as a substitute for professional therapy. And it can seem rather harmless and useful, especially for little simple questions. However, there are some downsides that I wanted to bring up and that I've also read about regarding using chatbots as an alternative to therapy. And so certain chatbots, such as Character AI, Replica, and ChatGPT, they're basically intended to engage users and will often tell them what they want to hear, just getting them to engage more with the app or the program. And so these chatbots aren't necessarily working towards treatment goals or symptom management with cures from a professional standpoint. One of the surprising things to me with chatbots is that people will be asking them questions regarding mental health issues, and the chatbots had reported back to engage in self-harm or suicide, or even in the case of like a drug addict to relapse into drug abuse. And so, of course, a lot of the organizations and companies behind these chatbots have changed some of the ways that they're run. But nonetheless, it is an issue. And then, of course, no chatbot is actually FDA approved as a form of treatment for mental health issues, nor are they necessarily backed by research science. But there is more research and program development being done to make AI chatbots safer. And there are some chatbots that are improving their features, such as Wobot or Therabot, so that they'll be more beneficial when they're queried on mental health issues. So a surprising statistic is about like 40% of people, sometimes more depending on what your source is, have a mental health condition, but they don't actually seek out treatment. So to me, that's kind of surprising. And the downside of the AI chatbots is that it seems like it would be a barrier or distraction for people to get the help that they need, which only prolongs suffering and can even worsen the problem. Now, of course, you can also say that there are some people out there who can't afford to be in therapy, or maybe they're in a therapy desert where there aren't enough therapists. So those are different issues which are not the subject of this particular video. As we're talking about going to therapy with a trained professional, there are some advantages that I wanted to also discuss over asking AI the mental health questions. So first off, when you see a professional, you're able to get a diagnosis and then also go over the treatment options for a specific diagnosis, such as like which treatments would be best suited for you. When you're working with an actual therapist, you can ask questions, you can get other feedback that would be helpful that you wouldn't necessarily get from AI. Additionally, you can get accountability from a live person in a safe context with the goal of growth and healing. And that is for you as a whole person, not just limited to a particular point in time. Because we are the accumulation of our life experiences, right? And then the dynamic environment that we live in and work in. So, and then third, another advantage is that you get an objective perspective based upon ongoing assessment, which, I kind of mentioned in the previous point. So like, what are the contributing factors that lead to your symptoms? And, like sometimes we don't really know what changes might be helpful, and it would be helpful to know those things. The other thing to consider too is that therapists will have to maintain patient confidentiality, and they're bound by other legal and ethical requirements, whereas AI does not. I did come across a list of how AI can be helpful to support somebody who is in therapy, which I thought was really helpful and interesting. So I just tried to condense it down a little bit, but the AI can be used as a reference tool to find simple explanations of concepts, such as what is mindfulness? Give me an example of an exercise or a meditation, or can I do a mindfulness exercise that is 2 minutes or less, for example. Another pro tip would be using the AI to help practice, reinforce, or track skills and assignments from the therapy session, such as remembering to identify what you're feeling and use assertive communication, or using stress management techniques that you learned a couple times a day, or whatever the goal is. And then the last pro tip would be if you wanted to do some small practice things with simple skills, on a daily basis.